बहुत बढ़िया.
Next, we have with us Dr. Gaurav Luthra. We are starting with a J&J session. This is the first case where we are starting with the catalyst. This is a 64 years male diagnosed with both eye cataract, and the patient is planned for left eye cataract surgery. This is the biometry for this patient, and the implanted IOL is planned to be 22.5. We are planning a synergy for this patient, and we are trying to calibrate the incision on a low IOP scale. The phaco will be performed. Over to Dr. Gaurav's OT, please.
Okay. So, hello. Am I audible?
Yes, Dr. Gaurav. You are
Great.
audible.
And you can see me?
Yeah.
Great. So, I don't need to be seen. First, what we'll do is we'll show you the patient's eye. It's a very deep set eye. And I've just put a speculum. Normally, I don't put a speculum, but it's a very deep set eye with a dense arcus also. Not an ideal eye for, anything related to cataract surgery. All the same. Now, I'll show you the parameters. So I'm on the Catalyst machine, which has now an upgraded software, which has lots of new things which can be done, including toric marking, and it has lots of other new features. But today, what we are doing is we are going to make a Rexis of 5. In fact, I'm going to increase it to 5.1 or so, because it's a hard cataract, and 6 quadrants cracking. And we are making LRIs also, which are anterior penetrating. So now the machine, new software has a inbuilt nomogram calculator. So if you want to calculate, initially we used to have to put it manually and go to the website and calculate. Now it has a calculator which can, using the Donenfeld nomogram, it automatically does the calculation for you. So you just have to press calculate, and it automatically feeds it into the laser. So also now new things are that it marks out the primary axis, and it can make the cracks along the primary axis if you want. And then once the LRIs are there for correcting about 1 diopter of astigmatism, now that means, because we are using a synergy lens which is going to require good astigmatic correction also. So this is all set up now for a good synergy surgery, hopefully, and we are going to see how it works. So the good thing about the Catalyst is that it comes with a fluid interface. So the Rexis is over in about 1 second, especially if you're doing an intumescent cataract. It's my first choice. There are patients who don't pay us also sometimes, and if there's an intumescent cataract, I'll still sometimes do this and absorb the cost myself for an occasional patient. Now, so this is the interface that we are going to use, and with me is Dr. Saurabh Chaudhary, who does way more numbers than me of the Catalyst cases. So torch. Okay, so here we are. Ek drop dal do, please. I want the cornea to be clear. So our patient is a very nice patient, very patient guy who's been waiting since morning. And so this is the cone which I'm going to use, the interface. There are sizes to the interface. And light mein dekhte rahiye. So I've done the vacuum capture now. So if you show the machine there, it's captured. And now we are going to slide up. Aap yahan dikhana, side se dikhayega. Fluid. Now we are going to put some fluid there. This is going to form the fluid interface. And now I slide the bed under the laser, and this is going to go dock. Wait, jab main bolunga tab karna. Yes. So now we've locked into place, and now we are going to bring the gantry up, the bed up to the gantry, and you can see that it's going to lock in. Now we can see here on the screen. Yeah, screen pe dikhayega. So we've locked in here, and we'll center it. There's a small bubble. I'll just nahi ho gaya. So that's, now we'll just center it a little bit, and then I press capture. So we've locked it, and then I lock it into place. So now, as you can see, that it's nice and locked. I say fluid confirmed over here. And you can see that the OCT scanning, it's a very high resolution OCT. It can capture the details of the posterior capsule, posterior polar cataracts. You can actually see if there is a break in the posterior capsule and posterior polar cataracts. So you can see that it's capturing the cornea right now. So femto has become my choice of procedure for several indications: hard brown cataracts, subluxated cataracts, and also some challenging cataracts like RK operated eyes, posterior polars. So now we are going to just correct the cyclotorsion here. Although this is not cyclotorsion control, we like to call it cyclotorsion. But cyclotorsion control is now possible on the Catalyst using the new, what do you call it? What's that machine called? Jisse karte hain? Cassini, with the Cassini, which I don't have currently. So here we have it, we have approved it. The Rexis is now showing up as nice and central. I've approved it. Now it's showing me the 6 quadrant cracks, which are going little beyond the rexis, so it's maximized. And now I'm showing the first LRI over here, and you can see that the depth is about 90%, 80%. The second LRI, and I say approve, and now it's approved. So we are all set. Now keep watching here in the middle. I'm starting to fire. The rexis will form in about 1 second. It's complete. And now we are doing the 6 quadrant cracks for the gentleman. And after this, right after my case, Dr. Rishi Swarup is going to show you his toric IOL implantation. He's come here all the way from Hyderabad on a river rafting trip. So this is the laser going on. You can see 76% of the nucleus is already cracked. Now 89%, 90%. It's a very fast system. In just about 60 to 70 seconds, this cracking part is over. And the total procedure time is just 2 minutes and 50 seconds. So you can see it's very fast. Sometimes even if I have 5 or 6 catalyst cases, they're over in about 30 minutes. So it's all complete now, and we remove the vacuum. What then? Tissue then? So now I'm going to just move it to the side. We had a cooperative patient, thankfully, so far. बहुत अच्छा हो गया सर आपका. So the laser is complete here. We will be moving to the other OT now for Dr. Rishi Swarup to show his case with the toric IOL on the Signature Pro. And we can move the transmission to the other OT. उनको बोल दो कि वहाँ दूसरे मॉडलर OT में चले जाएं अगर वो रेडी हैं सर तो. हाँ, थैंक यू. बहुत बढ़िया हो गया ये वाला पार्ट. वेलकम. नो क्वेश्चंस. डॉक्टर ओली, आपको नींद आ रही है?
It's quite technical things, so most of us were enjoying the things.
Yeah,
We were seeing how the things went very smoothly.
So the procedure is very fast, sir, and in some of the complex cases, it makes a lot of sense because Saurabh, you can come. Saurabh will tell some things to us. Come. वैसे तो उसका case है next, but we find that the catalyst is very useful for hard brown cataracts because there the OCT can still scan through it. It's transparent to optically transparent. You'll have a reddish hue. So the hard cataracts, it's very good. We can make a bigger rexis over there, and I like to do the hard cataracts. Posterior polar cataracts, we increase the offset. So there also it becomes very safe to proceed because.
How much offset to keep for polar cataract?
Sorry.
How much offset to keep for posterior polar?
Sir, normally we keep 500. In posterior polar, I keep around 700 to 800. Around 700 is good enough. And what it does is that it leaves behind an epinuclear shell. So you can remove the central core completely, and also you don't have to do any hydrodissection because the air bubbles which escape from the femto incisions, they automatically do a pneumodissection. So you don't have to rotate the nucleus, you don't have to do a hydrodissection. So all that has already happened. So that is another very good indication. And pseudo exfoliation eyes, again very shallow chamber eyes. Some these high hyperopic eyes which are very shallow chambers. You may have while doing the rexis, you may have problems with iris prolapse and all. So there again it's very useful because you can have a rexis without actually opening the eye. So many of these indications, again, intumescent cataracts, this is, as I said, the rexis is over in 1 second. So there is no risk of the runaway happening. Only in a very rare, again in subluxated cataracts where, the bag is mobile, you can get a rexis very nicely without having to do the rexis manually where, you may move the bag quite a bit or the lens quite a bit. So these are some of the indications, and also I think with multifocals and all where you need highest precision of the rexis and of your LRIs, they come very useful. So small astigmatism of 0.5 to 1 diopters, without using a toric lens, I can correct it with the LRIs. So I think we'll move on to Dr. Rishi Swarup.
So we are not getting the eye view. Okay, now we are.
Xylocaine drops. Light में दिखे. Manual registration कर लो. Just do a manual registration. We don't need Virion actually, just switch it off. अब आप लाइट में देखते रहिए. लाइट को देखते रहिए। इन्हों के नवी नीचे जब पियो कोई बात नहीं, नॉर्मल पास एयर निकाल के पिया करो।
Hello, 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 and a very warm good evening to everyone. This is Dr. Kanchan Negi, Research Development Expert, the Master of Ceremony for the program. And let me tell you that within a very short span of time, we're going to start with the official inauguration of the program when our eminent chief guest, Honorable Governor, Lieutenant General Retired Gurmeet Singh sir will be here with us. Sound? Please increase the bass. Hello, hello, check. Bass बढ़ा दीजिए भैया please. And can I have 2 cordless mics? ये mic check हो गया है? Hello, 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 check. Hello, 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 check. Hello, check. Hello, hello, hello.
And this zonal relaxation.
Tune in करिए भैया. Tune in, please. Hello, 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 check. Check, check. Hello, check. Yes. थोड़ा और. Tune in. Hello, hello. Hello, check.
Check. Hello.
So on behalf of the UKSOS, I welcome you all, the eminent delegates who have come here from across India. In the 18th annual conference of UKSOS, let me tell you that within a very short span of time, we will have our eminent chief guest, retired Lieutenant General Gurmeet Singh Ji, and Honorable Governor of Uttarakhand. And I just want to share the program, like the moment our Honorable Chief Guest will be here. He would be visiting the stalls first. He will be visiting to the scientific stalls, the exhibition of various ophthalmic instruments and medicines which are being exhibited. And after the visit to the scientific stalls, Honorable Governor Sir will be entering this auditorium, which is LT5. And then over here, he would be welcomed by the Principal and Dean and also Director Medical Education and Chief Patron of the conference, Dr. Ashutosh Sayana Ji. And thereafter, the Chief Advisor of the conference, Dr. B.K. Oli, Organizing Chairperson, Dr. Rizvi, Chairman of UKSOS, Dr. Harsh Bahadur, Secretary of Uttarakhand State Ophthalmic Society, Dr. Satanshu Mathurji, and Organizing Secretary of the conference, Dr. Sushil Ojaji, will be outside of the LT5, this auditorium, to greet the Honorable Chief Guest. Thereafter, the Honorable Governor Sir will be escorted to the front row, and he would be witnessing the 32 live surgeries which are going on. He would be witnessing the live surgery for like 5 minutes. Thereafter, we would be cordially inviting him for the lamp lighting ceremony, which will officially inaugurate this conference. Thereafter, there would be the session by our formal welcome by the chairperson of the organizing committee, that is Dr. Rizvi, followed by Honorable Governor's address. So I would request all of you to kindly take your seats so that on time we would be starting up with the program. Thank you.
It was a hard one. I know. So he इन्हीं का दिखाना है next because the governor wants to see 3D ना, तो next वहीं पे जाएगा. As soon as they say you switch it there. I don't think mine is visible. Although I think my LED is visible there, but communication is not there. अच्छा वहाँ दिख रहा है. बस बाबू जी अब 2 मिनट और लगेंगे. मोतियाबिंद तो आपका बहुत सख्त था, निकल गया. अब हम लेंस लगाने की तैयारी कर. तो इंदर कॉटेक्स नहीं हटाया हुआ है मैंने. कॉर्निया दिखते रहो. कॉर्निया इंदर कॉर्निया. इसको डाल दो ना उसके ऊपर थोड़ा सा. डॉक्टर रोहित को मत बताना कि गवर्नर देख रहा है, नहीं तो वो भी प्रेशर में.
साउंड सिस्टम प्लीज पे अटेंशन. हम लोग के कॉन्फ्रेंस जैसे ही हमारे ऑनरेबल चीफ गेस्ट हमारे बीच में होंगे, आई विल बी अनाउंसिंग. यू हैव टू फॉलो माई इंस्ट्रक्शंस प्लीज. जैसे ही हम अनाउंस करेंगे नेशनल एंथम का, आप नेशनल एंथम प्ले करेंगे. लेकिन ज़्यादा स्लो है, आप प्लीज़ चेक कर लीजिए आपके पास कौन सा वाला नेशनल एंथम है. एक बारी है ना, आप वो चेक कर लीजिए प्ले करके हल्का सा. एंड यहाँ पे सब लोग खड़े होके देन वी विल सिंग द नेशनल एंथम ऑल्सो. ऑल राइट ठीक है. फेस इज फाइन. आई एम सॉरी. ठीक है, पूरा मत चलाइए. थैंक यू. ऑल राइट, तो ये फुल वॉल्यूम आप कर देंगे हमारे अनाउंसमेंट के तुरंत बाद आप लोग प्ले कर दीजिएगा. सिमिलरली लास्ट में भी एंड में भी जस्ट लिसन टू माय इंस्ट्रक्शंस एंड देन विल प्ले द नेशनल एंथम. ओके, थैंक यू.
हाँ नहीं तो हमारे पास
ये
और
प्रोग्राम
cases हैं
से
ना,
पहले
उनको बोलो
और
finish
प्रोग्राम
करें।
के
हाँ,
बाद
ये 4 cases
दोनों में
हैं।
नेशनल एंथम चलेगा.
हाँ कराओ, स्टार्ट करा दो
वो अनाउंस करेंगे तो आप चालू करोगे.
आप रोक दो थोड़ा सा। ट्रांसमिशन नहीं हो रहा है, मतलब ट्रांसमिशन हो रहा है, कोई बोलने वाला नहीं है तो दिखाते रहो, कोई बात नहीं. एज लॉन्ग एज वहाँ स्क्रीन पे आ रहा है कोई प्रॉब्लम नहीं है. बस अब
Hello.
हिलना नहीं, लेंस लग रहा है आपका.
Gaurav, can you listen me? Drishti OT, can you listen to me?
हाँ, yeah, I'm coming.
Drishti IoT, can you listen to me?
Yes, sir, we can hear you.
आया उसको ना ओटी में मत रखो, जो लगने है बाहर रखो ताकि ठंडे ना हो जाए. तो खुलते भी नहीं है और फिर वो बिल्कुल टाइट हो जाता है. उनको बाहर स्टोर करो, ओटी के अंदर मत रखो, वहाँ ऑटोक्लेव के ऊपर रखो. जो ये वाला है ना नाइट एक वाला ऑटोक्लेव है, वो अंदर चिल हो जाते हैं फिर उसके बाद.
And I hereby request everyone to kindly
Hello.
keep your cell phones on silent mode,
How are you?
please. I
It's
hereby
been
request
happening
each one of
also.
you to kindly keep your cell phones on silent mode, please. Thank you.
नहीं यार, इनॉग्रेशन कर रहे हैं. गवर्नर सेड आई वांट टू कम टुडे एंड वॉच 3D. देख लो यार. He got so interested, he says मैं इनॉग्रेशन में चीजें बन के तो नहीं आ पाऊंगा, बट आई होप माय ऑडियो इज नॉट गोइंग देयर. माइक ऑफ कर दो. लाइट में देखिए थोड़ा सा, अगर दिख रही है तो.